Hello everyone. Today we have another lesson, which is ethics, philosophy, and trend in nursing. What is the concept of ethics? Ethics is a branch of philosophy that concerns the distinction of the right from wrong on the basis of a body of knowledge, not merely on the basis of opinions. Ethics deals with one's duty and obligation in relation to good character, behavior, values, and good morals. And that will take us to types of ethics. There are two types of ethics. We have the personal ethics and the professional ethics. Professional ethics, they are personal value and sets of ideas that control one's behavior. It is acquired as one develops and matures. It varies from individual to individual depending on one's past experiences, religion, and sociocultural factor. And that will take us to the professional ethics. These are established by members of a professional group, example, nursing ethics, medical ethics, and other professions. The ethics of various professions are prescribed in code through which codes the professional group sets standard of a practice for its members. They are under an obligation to follow the laid down rules and regulation. Otherwise, they could be sanctioned. The activities and the conduct of the members are monitored. The profession has code of ethics that affirm professional regard for conduct. The nurse is expected to establish a nurse ethical account. And that will take us to ethics in healthcare. What are the ethics, or what are the principles of ethics in healthcare? The general principle to healthcare is referred to as bioethics because the ethics affect every area of healthcare, including direct care of clients, allocation of finances, and utilization of staff. Ethics encompasses the whole of life, our conduct and behavior towards us, towards others, and towards the environment. Ethics does not provide easy answer, but it can help provide structure by raising questions that ultimately leads to answers. Several factors contribute to an increased need to provide healthcare in an ethical manner. And some of these factors are, number one, an increasing technological society that creates situations and make things easier. Number two, survival of newborn at earlier gestational ages by the provision of incubators and their equipment will solve a serious problem. Number three, clients are becoming more knowledgeable about their health and health-related intervention. Consumers' demand for information has increased, hence health care providers and must adopt quickly and increase in their knowledge. That will take us to the theoretical ethical theories. Ethical theories were debated by ancient philosophers such as Plato and Aristotle, and the debate continues today. Ethical principles can be used as a way to analyze ethical problems. No theory can provide the correct answer to any single ethical conflict. That will take us to technology. Technology. This states that the value of a situation is determined by its consequences. Thus, the outcome of an action, not the action itself, is a criterion for determining the goodness of that action. The theory is also called consequential theory. This was advocated by a philosopher, John Stuart Mill. That was 1996. The principle of utility is a basic concept of technology. Utility states that an act must result in the greatest amount of good for the greatest amount of people involved in a situation. Good refers to a positive benefit. Any act is ethical if it delivers good results. Every alternative is assessed for potential outcomes, both positive and negative. Technology, this is also an ethical theory that considers the intrinsic significance of an act itself as a criterion for the determination of good. That is, in determining the ethics of a situation, a person must consider the motive of the actor, not the consequences of the act. The theory is also called formalism. This was postulated by philosopher Immanuel Kant. Kant established the concept of categorically imperative, which states that one should act only if the action is based on the principle that is universal. The categorically imperative also mandates that a person should never be treated as a means to an end. And that will take us to the ethical principle. What are ethical principles? These are codes that direct or govern our action. There are 6 ethical principles. Number 1, we have, there should be respect, autonomy. There should be respect for an individual right to self-determination. Number 2, non-maleficence. One has an obligation to do good or cause no harm. Number 3, beneficence. The duty to do good to others and also to maintain a balance between benefit and harm. Number 4, we have justice. The equitable distribution of potential benefit and risks. Number 5, the obligation to always tell the truth. Number 6, fidelity. The duty to do what one has promised or keeping promises. And that will take us to the value and ethics. What are values? Value means the importance or the usefulness of something. Example, standard of behavior towards your client. Ethics also means the moral principle that governs a person's behavior or how an activity is conducted. Example, medical ethics. Nurses also need to examine their own value system so as to determine the best approach in managing the care of a client whose value may be different from their own. In order to practice ethically, nurses must understand their own values. Values are different from principles in that they influence the development of beliefs and attitude. Rather than behavior, they may at times indirectly influence behavior. Nothing in life is value-free. Values are similar to breathing. You do not think about it until there is a problem. And there's another question that says, how do values influence care? Our response to clients are based on our values. The quality of care to clients, the understanding of the value, and the interpretation of it brings about the best practices from nurses. Ethical codes. An international code of Ethics for Nurses was the first adopted by the International Council of Nurses, ICN, in 1953. It has been reversed and reaffirmed at various times. The most recent of this review and revision was completed in 2005. The preambles. Nurses have 4 fundamental responsibilities: to promote health, to prevent illness, to restore health, and also to alleviate suffering. The need for nursing is universal. This implies that nursing has respect for human rights, including cultural rights, the right to life, and the choice, to dignity, and to be treated with respect. Nursing care is respectful of and unrestricted by consideration of age, color, creed, culture, disability or illness, gender, sexual orientation, nationality, politics, race, or social status. Nurses render health services to the individual, the family, and the community, and coordinate their services with those of related groups.